Welcome to another episode of our Mental Health Moments. My name is Linda Golick. I'm the Health and Wellbeing Consultant at Bellin Health, and I am so pleased to welcome today one of our licensed behavior health therapists. We're welcoming Hannah Bauer today. Hi, Hannah.
Hello, how are you?
I'm good. I'm good.
Good.
So glad you could join us today.
Yes, I'm very excited.
Good, good. Well, Hannah, I just wanted to start out by maybe getting to know you a little bit and for our audience to get to know you a little bit. Why don't you tell us a little bit about yourself, how you
Sure.
started in this field, your background, and how you maybe ended up at Bellin?
Sure. All right. So, my master's is in social work, and so I did a lot of internships in mental health, and then I transitioned once I graduated. I worked inpatient for Bellin for close to 5 years, so I was able to get my hours and become fully licensed, and that was really helpful because it exposed me to a lot of different things. So I'm really comfortable now that I'm outpatient, dealing with just a wide variety of things. So my practice, I see kids as young as about 5 or 6, and then all the way up to, I think my oldest patient is like 97.
Okay.
So wide
Wide
variety.
variety.
Yes, which is nice for me. In terms of specialties and things like that, I work a lot with families. I work a lot with anxiety, depression, a lot of trauma just because of my background in the hospital. I do couples, I do individual, I do kind of a lot of things. I'd say half of my practice is probably adolescents and then young adults to the elderly, and kind of just general life stressors. I'm seeing a lot more people coming in that just want the extra support. There's no
Mhm.
exact crisis that's happening. They just,
Mhm.
are on kind of that path to wellness. So they just want that extra person that's not connected to them that can just give them that perspective. So that's nice to see.
Well, and how wonderful, because one of our goals with this series is to just really normalize that all of us
Mhm.
sometimes need some assistance in terms of
Yeah.
mental health, and how wonderful that people are reaching out for support.
Yeah, it's a very nice transition, because it's great to help someone
Mhm.
in crisis because it's
Mhm.
very clear that the help is needed, but it's really nice to have someone that's just like, I don't have anything particular going on, but like, what's your perspective on this? Or even just to sit there and then they can kind of process through or talk through whatever it is, because most of the time they know what they need to do. They just need someone there to like hear them and just give them some encouragement. So that's
Yeah.
nice.
It's almost like another component of preventative medicine, right? Like we talk
Yes.
about, we do preventative screenings, and we take care of ourselves in that way. And I love that people are doing that for themselves in terms of
Yeah.
mental health too.
Yes, yes, and then starting to even see, like, parents bringing their kids in that way also, so you can definitely see that there's a shift, so that kids are gonna,
Mhm.
grow up in an environment where therapy is normalized, and it's just kind of a part of keeping yourself okay.
That's great. That's
Yeah.
great. Well, we wanted to take some time today. So, Hannah and I are here in Wisconsin. If you're listening outside of Wisconsin, maybe this isn't the case for you, but winter arrived with a vengeance here in Wisconsin this week, and it continues to do so. And so, we really started to talk about really the effects of winter on mental health, and what that looks like, and maybe what people can look out for, and how we can take better care of ourselves. Because if you are in the Midwest, you know that this is the beginning, and we have several months that this is going to be our season. So we want to talk about what we can look out for, and maybe some tips and tricks, and get some information from Hannah today. So Hannah, let's talk about, obviously people know that winter is going
Yeah.
to hit at some point, but this week it really did. So what do you notice in your patients or in your practice when winter comes?
So across the board, winter's hard for, almost everybody.
Mhm.
Even though the beginning of our winter was even mild, which I think most of us were pleasantly surprised by, for people that love being outside and doing all the winter activities, like they were quite disappointed by that, and then now this week it's just a lot of cold and a lot of snow, and that's really inconvenient and it's frustrating for a lot of people. So something that I notice is just that general especially this time of the year, just that lull. People are a little bit more tired, a little bit more irritable, tendency to get
Mm,
sick. Things are just not what they want
yeah.
them to be. And I think it's really important throughout the year to have little check-ins with yourself just so you know more clearly like what your baseline is, because sometimes for a lot of people it kind of sneaks up on them and then you're in the middle of this like depressive feeling and you don't know how you got there. You just feel it. So if you know ahead of time like how your body's going to feel, if you are going to be a little bit more tired, if your body's a little bit more achy, you notice that your motivation is a little bit less. That's a good indicator that, okay, the seasons are changing. It's less light outside. We don't have a lot of sunlight. You're probably affected by the changing of the seasons and the weather. And same with kids. Some kids love being outside and this is a great time for them. But for some kids, they're inside a lot. And that's
Mm,
depressing. That's frustrating. And you might see a lot more
mhm.
behaviors that previously you hadn't seen. So for kids, a lot, especially I'd say like maybe 12 and under, what you're gonna see is just, like, problematic behavior, right? A little bit more irritability,
Oh,
maybe a little bit more
mhm.
defiance, just a lot of pent-up energy. The older you get, I think you feel it more, and it's gonna come out as just irritability, not wanting to do as much stuff, maybe a little bit more withdrawn, just it's hard to find the joy in just those little things that before was a little bit easier. So
Mm.
that's something I try to encourage people that I see just to pay attention to yourself, because if you know that something's wrong, like, you can do something about it. And the sooner you recognize that, the easier it is to deal with because it's really hard to pull yourself out when you're already in the middle of it. Does that make sense?
Yeah, absolutely. I think one of the things that we hear a lot about too, and we may be feeling ourselves, is kind of that lack of daylight that goes with this time of year.
Yeah.
What is going on with us as human beings? What does this lack of daylight like do to us?
I think it throws us off a lot, and you
Hmm.
couple in daylight savings, so just that shift in the timing, it's a lot. And I've noticed this year, for whatever reason, I don't know why it was different, but a lot of people really felt off and still continue to feel like something is just not falling into place. So I really encourage people, especially in that fall time, to schedule a doctor's appointment in the middle of this time of year, just so that you know what's going on. If you need more vitamin D, if you need to be taking some vitamins, if there's
Hmm.
something going on in your body that would make you more prone to certain sicknesses and things like that, you want to know that ahead of time so you can accommodate for that sooner. And two, as much as it's difficult, like just trying to get outside even for a little bit. I mean, it's hard to get some of
Hmm.
those sunny days, but they also make those like those sunlight lamps. I know those are
Hmm.
becoming a little bit more popular that people use, especially when you're working all day inside. And if you have your own desk, that's really been nice. Um, but yeah, it's just and it's cold, so if you have aches and pains, it's gonna feel worse. The cold is just it's hard on our bodies. The lack of sunlight is really hard on our bodies. It's hard for us to tell, like, when it's nighttime, when it's daytime, because the sunlight does not hit us very early, and it gets so
Hmm.
dark so soon. So even just productivity in terms of getting things done around the house, once it's 4:30, whereas in the summer
Yes.
that's fine, but when you get into winter, you're just like, "Okay, I'm ready for bed." Like, don't wanna
Right.
do anything anymore, and a lot of people are critical of themselves when it's so normal, it's so natural
Mm-hmm.
because there's not a lot of sunlight, your body is already starting to wind down, that's just naturally how
Hmm.
it goes. So that's
Hmm.
something I try to remind people, like, just be kind to yourself. Winter is hard. Your body's gonna behave a little bit differently because it's supposed to,
Yeah.
you're not doing anything wrong.
Yeah, and I really appreciate that you're you're telling us that because I think you're right. People are really hard on themselves and oh, I'm not
Mhm.
getting enough done and I'm not doing enough and but
Yeah.
truly your mind and your body are reacting to
Yes.
the lessened hours of light. We're
Mhm.
not getting direct sunlight very much at
Yeah.
all because
Yeah.
maybe we're outside a bit, but not as much as we would be in the summer.
Right.
That all adds up.
Yeah, and, like, even just the types of food that you eat, it's
Mm.
heavier
Hmm.
and it's more comfort foods in the winter,
Hmm.
and, like, if you have holidays and potlucks and things like that versus in the summer where you naturally eat a little bit lighter. Maybe you grill out a little bit more, you have a garden, and you're eating all those fresh vegetables. It's
Hmm.
it's just it's all different.
Yeah.
Yeah.
So one of the things I seem to hear a lot of, kind of this time of year, like people are coming off of that post-holiday time, and we know that holidays can bring up all sorts of emotions. But I
Mhm.
hear like, oh, now the holidays are over and I have nothing to look forward to, or
Yeah.
people are maybe disappointed with how their holidays went, and they weren't as
Yeah.
fulfilling as they had hoped for.
Yeah.
What are your thoughts on that? Like how can people help themselves kind of manage through those thoughts?
Sure. I think at the beginning is maybe adjusting the expectations for the holiday. You know, you see a lot, you get bombarded with commercials and the expectation that it's a lot of family time and it's wonderful and it's warm and you just are welcomed and it's this wonderful, loving experience. That's not the case for a lot of people, and I think we build up in our minds that it has to be this wonderful experience when for some people it's just a day. And maybe it's a day that they're dreading because they have to spend time with people that maybe don't love and appreciate them in the way that they deserve. So
Mhm.
I think at the beginning part, it's just adjusting some of those expectations and being honest with yourself. Like if you have to subject yourself to something that's not going to make you feel good, maybe you don't have to do that. And then on the other end, y- if you've had an unpleasant experience, it's allowing yourself to cope. It's allowing yourself to acknowledge, like, that is not what I expected. That's not what I wanted. I need to take care of myself. If you have to take a day off, if you have to take a step back and just pamper
Mhm.
yourself, do something for yourself that will make
Mhm.
you feel good, do that. You don't need anyone else's permission to do those things for yourself. Um, I encourage a lot of people to try to plan something kind of, a few weeks after the first of the year, because I think at the
Mhm.
beginning of the year, everyone has such great intentions and they have these resolutions and it's exciting, but it only really takes a few days before that wears off. And it's just, we're in winter. So, I encourage people to take maybe a couple days off, like do a staycation or just
Mhm.
plan a vacation if they're able to, or maybe you schedule certain times that you check in with family or friends that you'd like to see. With technology now, like you can FaceTime, you can see people, you can connect in that way. And sometimes you need things, especially in the winter, just to be scheduled so you have something to look
Mhm.
forward to every few weeks. And if you can get away and take a break from all of the winter and the lack of the sunlight, definitely do that if you're capable of doing that.
Mhm.
We need the break. You need the break. It's hard. It's stressful and it's a lot of work getting through because there's no specific end date. I think like in our heads, if we
Mhm.
know like, okay, this is
Mhm.
just 12 weeks, like we can power through, but it's not just 12 weeks. Winter can start early and it can end really late and it's hard to keep going. So just anticipating that at some point you may burn out. At some point you may be sick for a few weeks and that's going to take a lot out of you.
Yes.
So
Mhm.
just planning on taking some of those sick days. Maybe they're not scheduled, but not feeling so guilty when you have to take a day or two just to take care of yourself.
Yeah, absolutely. And I really think, we talk about some of that self-care and some of those good habits,
Mhm.
and even just kind of touching on what you were saying, like planning things. And maybe you're not in a situation where you can take a big vacation, but you still can plan things to look forward
Yeah.
to. So maybe it's a game night with friends,
Yes.
or maybe it's going to the movies with your kids, just
Yeah.
some things that oh, this is something I can look forward to. And if you kind of
Yes.
sprinkle those throughout the
Yeah.
winter, that can
Yeah.
keep you moving forward.
Yeah, and I think for some people, like, the idea of self-care is, like, you're doing something, but maybe it's, taking a step back and you're saying no to things. Maybe you have
Mhm.
something that previously you had been looking forward to that maybe does take a couple days, but you're just like, "I am not feeling it, and it is so stressful even just to think about getting ready to do this." Maybe you say no
Mhm.
this year. Like, sometimes self-care is just putting yourself first and saying, "No, thank you. I can't do that. I don't have the capacity to do that right now."
Yeah.
And that's okay too.
Hmm. It's that time of year where people do like to do those resolutions and say, I'm going to
Mhm.
take better care of myself. And also, potentially some of those healthier habits can also help us kind of combat some of what goes on in the winter. So what are your words of advice if people are doing that, thinking about doing that, setting up some goals or some better habits for themselves? What are your tips to help them be successful with that?
Sure. So usually it's really helpful to break down goals into smaller tasks. So even if it
Mhm.
feels like it's a pretty simple goal of, well, I'm going to exercise more. Like you have to break that down. Like what does more look like? How often realistically do you think that you can exercise? How long do you think you're going to be able to do that? And create a smaller starting goal of maybe it's a half an hour once a week and seeing how that feels and how that fits into your life and then building from there. I think the mistake that I see is that you have very well-intentioned goals, but it's hard to follow through. Life is busy. And then you get frustrated, you get disappointed, and then you feel like you're doing something wrong because you can't achieve this goal if it seems so simple. Realistically, these goals need to be broken down a lot more, and shared maybe with one other person that can be kind of an accountability partner.
Yeah, I love that idea too. And definitely the smaller chunks,
Mm-hmm.
and keeping things realistic, because sometimes people go from I haven't worked out at all and I'm going to go to
Yes.
the gym 5 days a week at
Yes.
5:30 in the morning.
Yep.
And
And
then
it's
all of a
like, no.
sudden by about the fourth day, they're so sore they can't move.
Yeah.
Then they miss a
Yes.
day, they beat themselves up. Okay, so
Yep.
how can we start things that are smaller, and
Yeah.
accomplish that for a week or two, and then
Mm-hmm.
continue to build on that? People are
Yeah.
much more likely. I think I read something the other day that said really like 90% of our lifestyle is based on our habits.
Mhm.
So yes, it's definitely worth it to work on your
Yeah.
habits and set some goals to improve.
Yes.
But as they always say, Rome was not
Mhm.
built in a day. And
Exactly.
so we we have to take some time to do that.
Yes. Yeah. And recognizing like what is a habit. Because I think there's a lot that we just accept as part of our lives and really it's small choices that we're making every day that we don't realize we're making and there's room for change in all of those small choices if you wanted to.
Yeah,
Yeah.
absolutely. So then, in terms of the winter blues and the winter depression, I think we all certainly, feel that from time to time. How do people know when they should seek out further help or further, medical treatment? What
Sure.
are those indicators? How do people know if it's more than just, it's winter and I'm
Sure.
I'm bummed because it's winter?
I think sometimes, even if you're having that thought of like, is this something different? That first indication that like this feels different, I'm a little bit concerned. It doesn't hurt to even just go in, schedule an appointment, go in for that first assessment, and then for some people it's just being told like, no, your feelings are normal. Like these are some of the things that you can do, and then they're good with that. I think that first indicator that and whatever feeling that it is that you're wondering what is going on, it's always helpful. Like even if it's just going to your regular doctor and saying, I'm feeling these
Mm-hmm.
things. Is this something to be
Mm-hmm.
concerned about? Just hearing from someone else, like, no, you're feeling normal things. Or like, yes, this seems like
Mm-hmm.
it's something that's concerning you. I'm a little bit worried because it's been lasting for a long time. Like, why don't you go in and be seen? I think it's just always
Yeah.
helpful to get some outside input. And if there's people that are
Yeah.
close to you also, if they notice a change, if they're like, hey, you've seemed off a little bit, like what's going on? You take some time to reflect and be like, oh, I have been off. Like, I don't know what's going on. Then, it's always a good idea, to ask for help, whether it's professional or not. If it's a doctor's appointment, that's a good first step because they can always throw in that referral. Some offices might have someone there that you can just touch base with really quick and you can get some of that information. So yeah, anytime that you have that like just that pause where you're like, "Oh, what's going on?" I think that's a good indication that you should reach out.
Yeah, definitely.
Yeah.
I think if people are really noticing it's a prolonged thing, right? It's not like a
Mhm.
couple of days of feeling a little funky. It goes on for a long time. It really starts to interrupt what you normally
Yeah.
would be doing with your life.
Mhm.
Give me
Yeah.
some indicators.
Yeah, a lot of people have described it like you're just in this state of yeah, just like pause, like you're stuck, like everything's kind of happening around you, but you just like, I can't do anything. Which again, yeah, that would be a good reason to just talk to somebody. It doesn't mean that there's some fix or you need to go on medication or like something really horrible is happening. It just means you might just need a little assistance right now, and that's pretty normal. That's okay.
Mhm.
Yeah.
So sometimes people ask us too, like if there's any like apps that we recommend, because there's an app for everything, right? So when
Hmm.
people are when people are
Yes.
feeling kind of blue or they're struggling a little bit, they're stressed out because of winter. Any apps that you would recommend for people?
Sure. And I think it depends on the goal, right? Like if it's more to connect with people, I mean, there's a lot of just free apps that people can download just to connect with other people and just talk. But in general, there's a lot more of the mental health apps or just the mental health and wellness apps,
Mhm.
Headspace or Calm,
Mhm.
things that can assist with just some of the guided meditation and just kind of grounding yourselves because sometimes that's what you need
Mhm.
when you're really stressed. Um, I know one that people really enjoy is Finch, and that would
Oh,
cause so it's a little it's a little I think it's a little bird, and so, like, several times throughout the day, it kinda checks in with you, and then you obviously are checking in with yourself to respond to some of the prompts, and, just kinda based on your actions and how you interact with this bird, like, it allows it to, like, decorate its nest and, like, to grow into these different things, and people it seems silly because 'cause you're just like, "It's this pretend bird," but people really enjoy it, it just gets you out of your head a little bit, and it gives you a purpose to doing some of these things that you need to do for yourself, but when you can kind of focus it on something else, it comes a little bit easier.
yeah.
Yeah.
Love that. And it's kind of a
Yeah.
little creative outlet too, right? Like
Yes.
the
Yes.
building of something or
Yeah.
creating of something, even if it's the
Yeah.
app doing it for you. There's
Yes.
something energizing
Yeah.
about creating something.
Yes. Yeah.
Love that.
Yeah. And a lot of people too, like you're inside more. So like even like the paint by numbers, I mean, you can do that on your phone also. You don't necessarily have
Mhm.
to go out and get supplies. There's like you said, there's apps for everything. So
It
even
really
sometimes
is.
just taking the time and if you have like this random inkling of, oh, I wonder if this would be interesting, see if there's an app for it, try it out. There's so many free apps for so many things. It's not going to hurt to try.
Yeah.
Yeah.
Perfect. Well, anything else you wanted to share with our audience? Anything else that you wanted to include today? Other things you want people to know?
I don't think so. Yeah.
Okay. All right. Well, Hannah, we really appreciate you doing this segment with us, and hopefully, you're going to be
Yeah.
seeing more of Hannah in episodes to come, and we're going to pull in some of Hannah's colleagues as well. So, some new exciting stuff on the horizon for mental health moments. So, you'll want to stay tuned for that. So, thanks for tuning in today. Please like, subscribe, and share this podcast. Otherwise, thank you, Hannah, and
You're
have a
very
great day,
welcome.
everyone.